Welcome to Med News India. Spine related issues, especially scoliosis, are becoming increasingly common around the world. This condition, where the spine curves abnormally, can cause severe discomfort and affect daily life. But here's the good news. Treatments are now more advanced than ever, with options like minimally invasive surgery that reduce recovery time and improve outcomes. And India has become a global hub for such cutting edge treatments. Not only are these options affordable, but they also offer a new way forward for patients seeking world class care. Take, for example, a patient who traveled all the way from Nigeria for scoliosis treatment. Her recovery is a proof that with the right care and treatment, a brighter tomorrow is possible.
For my daughter's surgery from Nigeria to India to Mumbai. I really thank God for what God did for my daughter for the surgery. It goes successfully. I thank the doctor. I thank all the nurses. I really appreciate for what God did for my family. For the surgery, everything goes successfully. Everything gets better. Fine. We are going back to our country, to Nigeria now. Thank you very much.
And the doctor behind this incredible transformation is Dr. Harshal Bamb, who is live with us. Just to give you a brief, that Dr. Bamb is working as head of spine surgery in Clinical Hospitals, Mumbai. Welcome, Dr. Bamb.
Thank you, Mr. Dushyant and Medsearch team for having me here.
So, doctor, could you please share more about this patient's inspiring journey and how these advanced treatment options made such a life-changing difference?
I think, Dushyant, it is important to understand that spine surgery has come a long way. We have been doing a lot of complex spine surgeries nowadays, and all the technology which is available with us, with our expertise and with the team approach, we try to give the best possible outcome to our patients.
So, doctor, there are so many types of spinal disorders. Which conditions do you encounter most frequently?
A very pertinent question. Actually, the most common problem for which one requires spinal consultation or spinal surgery is nerve compression in the low back or neck. So now we know back pain and neck pain is omnipresent. All of us suffer from it at least once in our lifetime. And it is jokingly said that as we grow older, we get grey hair, we become wise, and we have back problems. But when this pain in the back starts traveling down the leg or arms, causes tingling, numbness or weakness in the extremities, it is suggestive of nerve compression. And this is the point in time where a lot of us seek consultation to the spine surgeon. And that has been my OPD also, that most of the patients with nerve compression come to me. Back pain and neck pain has been predominantly more nowadays because of long sitting jobs in younger individuals. Yes.
We know that scoliosis can present in different ways. What are the key factors you consider when determining if surgery is needed for a scoliosis patient?
So I think it is important to know what scoliosis is. So scoliosis is an abnormal curvature in the back. It usually presents as a deformity of the back in patients. And now when patient notices or the family member notices about this abnormal curvature in the back, they're usually concerned about the cosmetic appearance. Now what determines my treatment broadly is three things. One, the amount of deformity or the curvature. Second, what is the age of the patient? And third, how has it progressed from this inception? So when you notice it till today, how has it progressed? So that typically determines treatment modality for me. Now in certain scenarios, the deformity can be associated with neurological symptoms. These have to be addressed differently and sometimes urgently. But it is important to know that a lot of these children are otherwise normal. They're intelligent, they are charming. And as and when this deformity is corrected or halted, we expect them to have a very near normal life and functional life.
We got to know that you treated a patient from Nigeria who was suffering from scoliosis. Can you give us some insight into how you treated her?
So yes, that's an interesting case. So Jessica was from Nigeria and her deformity in the back was noticed quite early in her age. But due to lack of good guidance and proper care, no treatment was offered for her till she became 15 years old. And when we got to know about her scoliosis, the deformity in the back or the curve was fairly large and very rigid or fixed. That means the correction was not possible. It was not supple. And once we got to know about her, we had a detailed evaluation of the deformity. We had multiple rounds of counseling and communication with the family to understand the problem, to tell them what to expect, and also what treatment are we proposing for her. After having a detailed evaluation and discussion, we undertook this scoliosis deformity correction surgery for her and successfully treated her to the tune of 70 to 80% correction, which is a very good correction in rigid scoliosis. And I would be proud to say that she has gone to school and she's also playing with her friends in a month's time after the surgery.
How has minimally invasive surgery changed the landscape of spine surgery?
I think we are in the age of innovation and science. And as in every field of science, a lot of innovations are happening. So as in spine surgery, the minimally invasive spine surgery, as we call it, have become the forefront of the spine care now, and which we are able to tackle most of the spine problems with a very small cut with the use of advanced technology, be it a simple disc removal or decompression or a complex fusion surgery. We are able to do all the surgery with MIS. MIS, as it is called, has greatly improved our patient outcomes, have reduced hospital stay, reduced the cost to the patient, and has significantly improved the post-operative pain and time to recovery. So most of our patients after MIS surgery go home in a day or two's time. They start their work in a week's time.
In your experience, what are some common misconceptions that people have about spine surgery?
A very important question, and I think most of us would relate to this question because either for ourselves or someone in the family, surgery has been ascribed or told by someone, and this becomes a major point of discussion in the family. So I would like to point out a few because it's a very long list. But the most common misconception, and if I may say so, is fear of surgery or denial. I know it is very pathology dependent, but if you require surgery, don't let fear dictate your decision. It is very important that spine surgery are nowadays done safely. Lot of technology and lot of advancements have come in, and that's why these surgeries have become a normal surgery or routine surgery for us. The second most common misconception is, am I too young or am I too old for this surgery? And I would say that spinal problems happen in different age groups. Younger patients usually get disc prolapse or trauma-related problems, whereas elderly patients get multi-level nerve compressions or osteoporotic fractures, and they have to be tackled appropriately at the right time. So age is not a barrier in spine surgery and should not be considered as a contraindication when we are talking about spine surgery. And I would also take third point here, that if I get spine surgery, I would become bedridden or disabled for life. Please, this is absolutely wrong. Nowadays, we do these surgeries to make you active, independent and pain-free. And I think if it is done by a right person at a right time, by a right technique, you will have the best of the results.
So doctor, can you share any innovations in spinal surgery or treatment that have excited you recently?
Yes. Science has gone so far that now spine surgeries have been done by keyhole surgeries as a minimally invasive technique. And we are having computer-aided navigation, which you talked earlier about. We are using augmented reality in many centers, and we are also having robots available to do the spine surgery. So innovations are coming in, but it's very important and apt to understand, do I need those innovations in my surgery? Is my surgeon is using these innovations regularly? And this is very important to find a balance between what is up there and what is required for me. And I think that is where a right person to guide you is very, very important.
Do you work with other specialists like physiotherapists or neurologists during a patient's recovery process?
Important, and this is the time I would take. I'd like to make a point that spine care is not one person's job at all. Okay, it's a team approach. And we talked about all the things about surgery, but you have to always remember that 95% of the back problems do not require surgery. So may it be a conservative management or surgical management, team approach is very, very important. It is important to have a good guidance by a good spine clinician. You have to take sometimes help from neurophysicians, a structured rehabilitation and a physiotherapy protocol by physiotherapists. Occupational therapist is very, very important, and also spine has a lot of issues with emotions, mental attitude and everything. So it is important to have a counselor on board, and that is why we have made a team here with us. We have all these facets taken care in Gleneagles Hospital, Mumbai. We try to give you the complete care for your spinal problems.
Lastly, what advice do you have for someone who is dealing with spine related pain or is considering a spine surgery?
Three things which I would want to tell you first. First thing which we talked about, misconceptions. So don't let fear guide your treatment. Okay. Now second point I would like to make is important that back problem is so omnipresent that everyone has some treatment available. A chai wala near you or maid in your house to the CEO of your company. Someone will tell you, oh, I have this problem for spine, I have this solution for the spine problem and everything. So I think a proper guidance is very, very important. So whenever you have any issue, you should judge your problem, you should judge your disability and find a right person to give you good guidance. It is important to know that if your problem is coming in the way of your work or function, a consultation with spine surgery is paramount, you should take it. Most of the spine surgeries do not require, most of spine problems do not require surgery. They just require a good, proper guidance, a disciplined change in your lifestyle, regular exercise and fitness regimen, and weight control. So, and also keep in mind the posture and ergonomic at your workplace. So, we need to have a healthy back to have a healthy and productive life.
Thank you so much, doctor, for sharing your valuable insight with us. It's truly inspiring to hear about your work. Thank you once again.
So much, Dushyant and Red Search team for having such initiatives. This helps us to reach the corners of the world through you. Thank you so much.